And welcome back to the program. Here's a question for you. Is your genetic story written in stone, or can you change it? Well, joining us now to answer that very question is Dr. Marga Macias, a pediatrician and epigenetics expert dedicated to helping people transform their health. So, Dr. Marga, please tell us, can we change our genetic story, or is it written in stone?
Absolutely, we can change the story. We have the power to change the destiny of our health. It doesn't have to be just because you inherited that you're destined to have that you are stuck with a disease for life. Because by changing your lifestyle, for instance, the diet, how much sleep you get, how much stress you allow in your life, you can actually reverse changes or damages that were done from generations past.
But you're not saying I can suddenly become Ryan Gosling because I want to change my genetics, right?
No, it takes work, it takes practice, and it's a complete lifestyle change. Like I always like to tell my parents, the parents and the patients, this is not a sprint, it's a marathon. It's a habit, a lifelong habit that you need to maintain. And I like to show it to them as like saying, okay, what's your goal? Is it health? Is it wellness? Is it success? So let that be your North Star. And sometimes we veer away from that. And veering away is fine as long as we recognize where we are heading and then head back towards it. Like, is this action going to bring me towards health, or is it going to bring me away towards it? Is it going to give me more problems? And if it is, it's a good thing to recognize it and listen to the advice of the experts so that you can redirect yourself back to where you want to go.
You know, I feel like this interview is a little bit of tough love. You're telling me if I'm overweight, if I don't feel healthy, that I really can't blame society. I can't blame anybody else. I can't blame my genetics.
Yes.
That I do have the power to change some of those unhealthy habits.
Absolutely. I've seen so many success stories in the 30 years that I've been practicing that they are so inspirational. They are my heroes, and they're the examples that I use to help to show parents and children and teenagers that you can do it. The power's in your hands, but you have to want to get there.
I want to mine that 30 years, that 3 decades of medical experience that you have to talk about something in the news right now.
Yes.
We've been seeing an outbreak of measles cases in West Texas and other places around the country. A lot of people think measles wasn't that eradicated. We got rid of that a while ago. But we're seeing this, and particularly in societies and communities where there is skepticism to vaccines.
Yes.
So you have 3 decades of medical experience. What is the science showing us on those vaccines?
Well, before even a vaccine is approved, it goes through multiple agencies to test for safety, effectiveness, and side effects. And it doesn't stop there, because after the vaccine is approved, we still monitor for safety and side effects, and adjustments are made according to that. And just to put things in perspective for you, before the measles vaccine came into play, there were around 4 million cases of measles in the United States. And approximately of those 4 million, around 500 deaths per year, United States alone. But since then, between especially 2000 and 2018, with the advent of the measles vaccine and using the measles vaccine, there was a 73% decrease in deaths.
Well, that means that
worldwide.
3 out of every 4 deaths were prevented.
Yes, yes.
So children do not have to die from measles. There is a vaccine for it. And you're saying, based on the science and based on your 30 years of experience, it's safe.
Yes.
Wow. As a pediatrician, let me also ask you about another topic, childhood obesity. What kind of patients are you seeing in your office?
There are a growing number of obese children from as young as the age of 2, 3, and all the way up to the teenagers.
2 years old?
Yes, yes. And it's scary because we always plot the height and the weight. And I see so many patients whose body mass indexes are going higher and higher. Above 95% is what we considered on the obese range. But when you look at what it is at home, they're sedentary ever since the new age of all these electronics. They don't be playing outside. They're glued. The only thing that does the exercise are their thumbs. That's why they're great at thumb wars, because this is very agile. But then they lose the playfulness, being outside, riding the bikes. That was my favorite pastime. They become sedentary. And then we have the parents who don't want to deal with preparing meals or to help them. So it's fast food, it's junk food that they just bring home for the children. So it's an education on so many levels. Like I said, it all depends on what the age is. If it's a younger child, I speak to the parents because they're the ones buying stuff. They're the ones who are showing examples to the children. And if you're older, you're a teenager, able to understand me, then I'll speak to you directly so we can get to the root of the problem. Because in my world and in my practice, especially for me, prevention is the key. I would rather keep you from getting there rather than treat you when you're already there, especially for something that is reversible.
Right, it's better for you as a patient, it's better for the medical system, it's better for
Yes.
your wallet. So essentially your prescription is be healthy.
Yes.
Do healthy habits.
Yes, absolutely. I can make a big difference.
Let's talk about your personal health. You went through quite a journey to get where you are today. And a lot of people think, well, a doctor, they know exactly what to do. They're never going to get sick. They're always perfect, right? You went through this really trying time. And I'm wondering if you could tell us about it and how it now informs how you practice medicine.
Well, I nearly lost my life in 2008 from a ruptured aneurysm in my brain. I always thought, I have migraines, that's probably it. But that was my biggest wake-up call because leading up to the aneurysm, I was pre-diabetic, I had high blood pressure, I was under tremendous stress, I was depressed, and I felt like the weight of the world was on my shoulders. And I was struggling as a single mother. But then when that cerebral aneurysm happened, that was my wake-up call. So I said, okay, I got this far. What have I done to get myself there? And so as much as I could, I eliminated the unhealthy habits that I had, and that brought me to where I am right now.
We're so glad you're here. We're so glad you've recovered, and we're so glad you're able to provide advice that is impacting positively so many lives. Thank you, doctor.
Thank you so much, too.
We'll be right back.